Shirley, are you okay? Shirley?
Coumadin is an anticoagulant that interferes with the synthesis of vitamin K-dependent clotting factors. Vitamin K is a vitamin that is found in many vegetables, such as kale and broccoli. What are clotting factors? Clotting factors are proteins that control the bleeding in your body. The clotting factors that are affected by Coumadin include prothrombin, proconvertin, plasma thromboplastin, and the Stewart-Power factor. Coumadin is typically used to prevent and treat emboli, which block blood vessels in the body. It's also used after prosthetic valve replacement surgery to prevent the formation of blood clots. Your doctor will determine the correct dosage for you with a series of blood tests after you are prescribed a low dosage of Coumadin and have taken it for 2 to 4 days. Lower dosages are used in the elderly, patients of Asian descent, and patients with genetic disorders. Side effects and adverse reactions can include dermal necrosis, cramps, calciphylaxis, bleeding, or fever. Let your doctor know if you have symptoms of these potential side effects. For healthcare professionals, it's important to be aware of how to properly treat a patient who is taking Coumadin. Assess for signs of bleeding and hemorrhage often. Assess for evidence of additional or increased thrombosis. Monitor PT, INR, and other clotting factors frequently during therapy. Monitor more frequently in patients with renal impairment. If overdose occurs or anticoagulation needs to be immediately reversed, the antidote is vitamin K. Administration of whole blood or plasma may also be required in severe bleeding because of the delayed onset of vitamin K. If you experience severe bleeding while taking Coumadin, contact emergency services immediately. It's important to take Coumadin exactly as directed to you by your doctor or pharmacist. Avoid foods that are high in vitamin K. Also avoid cranberry juice, alcohol, and NSAIDs. Do not participate in activities that have a high potential for injury. Use a soft toothbrush, do not floss, and use an electric razor while shaving. Notify your doctor immediately if you suspect that you are pregnant or you are planning to become pregnant. Coumadin is not to be used while breastfeeding. Frequent lab tests are important to determine if the dosage you are taking is effective. Consult with your doctor before taking any new medications. If you have a history of blood clots, ask your doctor if Coumadin is right for you. Activase is a thrombolytic drug used to dissolve blood clots after an ischemic stroke or heart attack. Dosage of Activase is dependent on the body weight of the person receiving it. It is given through an intravenous line. After giving Activase, be sure to flush IV lines with at least 30 milliliters of normal saline or D5W to ensure that all medication is received. It is best practice to withdraw the amount of unneeded medication from the vial first to ensure the proper dosing is given. For best results, Activase should be given within 4 to 6 hours of symptom onset of a heart attack and 3 hours for an ischemic stroke. Do not give aspirin, heparin, or warfarin for several hours after the infusion of this drug. Do not shake vials when reconstituting Activase. Slight foaming of this drug is normal, but let it stand for several minutes before administering to ensure that large bubbles dissipate. Possible adverse reactions for Activase include bleeding, hypersensitivity, reperfusion arrhythmias, sinus bradycardia, cholesterol embolization syndrome, ventricular tachycardia, recurrent ischemic stroke, and hypotension. For healthcare professionals, it is important to monitor the patient taking Activase frequently. Monitor vital signs and neurological status at least every 4 hours. Assess for bleeding and bruising. Assess PT or TT every 3 to 4 hours during treatment. If severe interactions or toxicity occur, discontinue the infusion immediately. Apply pressure to control bleeding. Cross-match the patient's blood to prepare for possible transfusion. Place the patient in Trendelenburg position and monitor blood pressure every 15 minutes. If you're a patient who has recently been given Activase, report any abnormal bleeding or bruising to your doctor. Use an electric razor while shaving and a soft bristle toothbrush. Report a fever, purple skin, or an abnormal heart rate to your doctor immediately. Activase is a life-saving treatment and should be given by healthcare professionals only. It is important to immediately contact emergency services if you experience symptoms of a heart attack or stroke. Time is essential to be properly treated for these conditions.